Most everything that we have here are resolutions, and I'm going to put a consent agenda here together. I'll read them out. You let me know if you'd like any of them to come off. RS 2023-1952, Johnson, Sepulveda, Gamble, and others appropriates $326,800 in American Rescue Plan funds from Fund 30216 to complete funding allocation to the Office of Family Safety to be used to address increased demand for therapy and services for victims of abuse, human trafficking, and interpersonal violence. RS 2022-1953, Robert, Syracuse, and Welsh approves a grant from the Tennessee Office of Criminal Justice Programs to the Metro Office of Family Safety to plan and implement a two-day conference hosting Tennessee Family Justice Center's personnel, coordinated community response teams, and Family Justice Center partner agencies to enhance interest and reach of multidisciplinary teams to reduce gaps in victim safety and offender accountability. RS 2023-1954, Roten, Syracuse, Hurt, and others, approves a grant from the Tennessee Department of Health to the Metro Board of Health to improve the health of the citizens of Davidson County by preventing and controlling the use of tobacco and tobacco products. RS 2023-1955, Roten, Syracuse, and Welsh approves a strengthening public health infrastructure workforce and data systems grant from the Centers of Disease Control and Prevention to the Metro Board of Health to implement workforce strategies to build organizational resilience, promote employee well-being, and enhance workforce performance while focusing on building healthier communities. RS 2023-1956, Roten, Syracuse, Welsh, and others approves a grant from the Friends of Metro Animal Care and Control to the Metro Board of Health to provide funding for various programs for shelter animals. RS 2023-1957, Roten, Syracuse approves Amendment 1 of the Epidemiology and Laboratory Capacity for Infectious Diseases grant from the Tennessee Department of Health to the Metro Board of Health to support all construction requirements associated with the cooler expansion project for the Office of Medical Examiner. RS 2023-1958, Roten, Syracuse, and Welsh approves Amendment 1 to a Nashville Health Accelerator Plan grant from the Centers for Disease Control and Prevention to the Metro Board of Health to address social determinants of health to improve chronic disease outcomes among persons experiencing health disparities and inequities. Hopefully everybody has done their homework on these. Is there any of these that need to come off of the consent agenda? Seeing none, all in favor of the consent agenda, say aye. Aye. Against? Any abstentions? Thank you very much. So we pass our consent agenda. On the bill on second reading, we have one. BL 2022-1571, Stiles and Gamble, amends Title 8 of the Metropolitan Code of Laws relative to animals. Can we get a motion? Second. All right. Councilmember Stiles. So you co-sponsored, Councilmember?
Yes. There's a motion to defer to the first meeting in July.
All right. So we have a motion to defer to the first meeting in July. Got a second? Any discussion? All in favor of the deferral to the first meeting in July, say aye.
Aye.
Against? Abstentions? All right, so that concludes our agenda. Did we want to discuss anything beyond agenda items?
We did request the opportunity just to provide an update to this committee on the Humana Vanderbilt situation, if I can call it that.
Please.
We have representatives from Metro HR, including HR Director Shannon Hall. Just a very quick synopsis. Last Monday, the mayor's office was informed, in part through the assistance of Councilman Nash, of Humana's, or rather Vanderbilt's decision to terminate the Medicare Advantage plan through Humana. Had heard anecdotally that they were issuing similar termination notices to other insurance companies. A letter went out from the mayor to both parties that was been distributed to the council members, essentially pleading with both entities to remain at the negotiating table. And if that was not an option, could Vanderbilt nevertheless continue to see these beneficiaries as out of network? That has been a solution applied in similar instances in the past. Humana wrote back the next day, and that letter was distributed to council members, and without putting too fine a point on it, essentially said, we're ready to negotiate. Vanderbilt's just not willing to negotiate. I know there are two parties to this, and we're not putting stock in any one particular party side. Kristen Wilson, our COO, and Sam Wilcox in our office, the following day did get a phone call from Vanderbilt, essentially asking questions about how would it work to provide coverage for beneficiaries out of network, and they were sent some information. That is the last I've heard is an update from Vanderbilt, but perhaps there's more. Why don't I shut up and let the real experts update this committee?
Sure, thanks for that update.
I would say, just first off, my huge thanks to the mayor's office and particularly to Mike Jamison. I mean, I really feel like the information he's crafted and shared is completely accurate, is a really great detailed summary that kind of outlines the issue. I do want to make, just for anybody who may be watching and some of your constituents, because I think a lot of this for pensioners feels like it's related. Vanderbilt's decision to possibly terminate Humana as a Medicare Advantage provider at Vanderbilt is a separate issue than the transition of pensioners into the Medicare Advantage plan, the Metro Medicare Advantage plan, which is a very unique plan. It is very rich. It is custom designed by Metro. It has the same level of benefit to the pensioner in the network and outside of the network. That is a very unusual arrangement, but it is meant to be very comprehensive for its members, which are specifically Metro pensioners and their dependents who are Medicare eligible post 65. So for some of this, I think for some of our pensioners and their dependents, it feels like, oh, I knew this was coming. These are two separate issues for which we had no knowledge, at all. And obviously the change for the Medicare Advantage plan has been something that's been well discussed publicly on multiple levels of government and publicly with the Study and Formulating Employee Benefit Board, the council, our office for the better part of 14 months we've been prepping this transition, just to administratively make this a smooth transition. So this is something that caught us all off guard, and not something we could have anticipated. Most large medical insurance providers like Humana, Blue Cross, Cigna have with major hospital providers what are called evergreen contracts, meaning they don't really have a termination because the intent is never that major insurance providers would be out of network with major hospital corporations, right? This one was the same, and it was only at that time that whatever preliminary conversations that had occurred between Humana and Vandy, I guess, were not acceptable to Vandy, and then they decided to send the communication out the first week of January. So the timing of this is awful, and so for pensioners, I think those two things are getting confused, and I want to make sure we distinguish those so that, oh my God, this is the last thing. I mean, as you guys are getting calls, our poor staff, both the breadth of calls and the tenor and the tone of calls, pretty awful towards our staff. And we're doing the best we can to reassure pensioners because, frankly, some are scared. So I want you to know we're still facilitating information. Some of the questions that Vandy had, I personally facilitated that information back to Vanderbilt so that they understood how the out-of-network provisions would work on Metro's plans should they want to pursue those. But my overarching message was, because this does impact Metro retirees, which that is my primary focus and job, but the reality is for you all that post-65 constituents, the majority of which have a Medicare Advantage plan in the United States of America, that could impact your constituents. So I said, while I can explain to you how the Metro members could be protected if you were willing to accept this arrangement, I still encourage both parties to reach a network consensus as soon as possible, because switching doctors is very hard. I will tell you, and please don't hold me these numbers because they're a little fluid. We can only have, I can tell you loosely the numbers from our 2022 plan year when 40% of our Medicare eligible population was voluntarily in this plan, so last year. Of those 40% of members, give or take 15%, use Vandy, I'm sorry.
Yeah.
Give or take.
Yeah, I wasn't sure what 15%
15 to
you were
18%,
using.
I think.
Yeah.
Use Vanderbilt. So the majority of our population's not regularly using Vanderbilt. However, I do not want to discount the significance of Vanderbilt being our network because Vanderbilt, like other insurance corporation or hospital corporations, self-refer. So for that 15 to 18%, it's likely all of their doctors, right? So for those people it's impacting, it's pretty catastrophic. And then you layer on the fact that this is a pretty vulnerable population that's post-65, and then changing doctors post-COVID is like an act of Congress. I mean, getting someone to accept that insurance. So I want you to know that we are treating this about as seriously as we possibly can. This is a top priority for our office and the Employee Benefit Board. We are working daily on solutions, trying to figure out whatever collection of solutions we can to make sure that Humana and Vandy reach some kind of mutual agreement, because that is in the best interest of the citizens of Davidson County and our membership.
Thank you. Yeah. So, Councilmember Johnson's
So this isn't just Metro, this is across the board. Anybody that has the Humana Medicare Advantage can't go, well,
Correct.
Vanderbilt is saying thanks but no thanks. So we're facilitating for our Metro retirees, but it actually will hopefully end up affecting in a positive way.
Yes,
Okay.
and I believe the mayor's communication, which Mike Jameson shared with you, articulates that fact to both parties, right? This is, while our primary concern is absolutely for our entire post-65 population, right? Because we have to procure, medical services are expensive. We are subject to procurement laws like everything else. So we procured this service. Humana is the current administrator, right? It's not like we get to just pick and choose, like, oh, we like Blue Cross today, and we'll just switch to that administrator. We're subject to the same procurement rules, and insurance and medical care is high dollar. So we are absolutely subject to that, and that's how we've arrived with Humana as our provider. So yes, it is for anybody who has got a Medicare, a Humana Medicare Advantage plan in the area. And frankly, knowing Vanderbilt's kind of trauma 1 status, I may be using that correctly or incorrectly, it really does impact all of Middle Tennessee and frankly parts of Southern Kentucky as well. I know that Kentucky, a lot of their retirees also have usually a Medicare Advantage plan through the state as well. So it does have some pretty broader implications.
Thank you. And this may be for Mr. Jameson. Do we know the status of negotiations between Vanderbilt and Humana? Are they open? What's the probability of them coming to an agreement soon?
We have not gotten an update from, not a written response from Vanderbilt, and the written response from Humana was, we're ready to continue negotiating. Humana maintained that Vanderbilt insisted on a 20% fee increase and essentially walked away. Whether or not that's true, again, I just want to underscore, we know there are 2 parties to this, and we would like to hear from both. We've reached out to every one of the major employee organizations that have anything to do with representing Metro labor groups, the Fraternal Order of Police, the SEIU, the Firefighters Local 140, the MNEA. Ask them all to share intelligence on what you're hearing about the negotiations, and can you likewise inform your membership. I have, since last week, not heard anything to indicate that they have returned to the negotiating table, but I'm hesitant to tell you they haven't. For all I know, they may. The vice mayor, I think, did get a contact from Vanderbilt Council, but I don't know that he heard anything indicating that they were back at the negotiating table.
As of this morning, the board's taking this seriously. So is Humana. They have offered to be present at all our benefit board meetings to give updates. They gave an update this morning and said they had a willingness to continue the negotiations, and they hope that Vandy would join them. But to date, there have not been further negotiations as of this morning with Humana.
Thank you.
Vice Chair, did you have your hand up earlier? No? You're good? Okay.
I just have one more. So what precipitated this was Vanderbilt wanted to get paid more, and Humana said no. And so then Vanderbilt said, okay, we're not going to accept you at all anymore.
So that's the gist. What I've heard from Humana this morning, which was validated in conversations we're having with Vanderbilt, they are consistent, is that Vanderbilt asked for, I believe, a 20% increase over Medicare fee schedule. That was too big a price to bear, and that they had made a couple of offers, including cash payments to Vanderbilt and others that were not attractive to Vanderbilt and were declined. So
Vanderbilt canceled it, not Humana.
correct.
Has Vanderbilt, I know you're saying Vanderbilt has not, I guess, provided any information. I guess I'm answering my own question. So is Vanderbilt just not saying anything to Metro
through HR or through the administration, is Vanderbilt just silent on this?
I'm very reluctant to cast aspersions against either party, and I'm reluctant to just take Humana's version of it and say that's gospel. Maybe that is the case. All I can tell you is we've not gotten a written response from Vanderbilt. They did telephone Kristen Wilson and Sam Wilcox and ask for information on how would this out-of-network billing work, and were provided that information. There may have been subsequent communication since that I'm unaware of, but I have not heard anything formally indicating that they've returned to the negotiating table. A couple of things that may or may not be slightly reassuring. This is historically sort of a cyclical event. We have large providers that play hardball on reimbursement rates, and there's a lot of saber rattling, and it gets resolved, often through out-of-network billing processes. We have heard, anecdotally, I cannot confirm this, that at least one other provider that had been terminated, they reached an accord. So there's hope here that Humana can be in the same boat, but that I have not got formal verification of that. This is rapidly evolving situation.
Thank you, Chair. May I ask a question to HR?
Sure.
Thank you. In the event that there is some type of negotiation reached where, maybe it's not the 20%, maybe it's 10% over or whatever that is, does that cost come from Metro, or is that coming out of the pockets of the retirees?
You want the honest answer?
Of course.
Ultimately Metro, right? I mean, this is fully insured product. The way that Medicare Advantage rates are set are on an annual basis. A lot of, Medicare Advantage plan, a lot of the regulations surrounding that and how it operates and how rates are set are governed by the federal government, because they are giving essentially the Medicare money over to the insurer to allow them to administer that benefit on their behalf. And likely others, it becomes a more comprehensive benefit for people that utilize those typically. So, and I do want to mention, I know we've talked a lot about Humana. This is not a Humana issue per se. We have heard of others, and in fact, Vanderbilt has formally taken this position with Humana and WellCare. So this possibly, if you have constituents with WellCare, and if you've ever tried to help someone navigate the Medicare insurance market, you definitely have choices, but you have to go on to Medicare.gov. You put in your zip code, and then they tell you these are the options. You don't necessarily just get to shop wherever you want. There are only certain plans that are available to members. I've helped my parents individually navigate this. And they're not Metro pensioners. So when you do that, you get a collection of these are the plans that are offered to you that you can pursue. So WellCare, right now, Vanderbilt has given this notice for 4/1 to WellCare and to Humana. We are aware that there was a potential threat with another major insurance provider. I'll say it's Cigna. But they verbally, we understand they have reached an agreement, but I do not know that has been done in writing. So it is not, I want you guys to also know this is not necessarily singling out Humana. This is, I think, something that has happened more broadly.
Thank you. And then my last follow-up to that, what is the price tag on the 20% increase? What could that potentially cost?
I don't know, because we knew what Humana had said, but we don't really have a formal response. I mean, I have no reason to think that Humana's not telling the truth if that's what they've asked for. And then my question was, well, we don't know what the reimbursement rate is between Humana and Vandy. Is it 20% on that rate? Is it 20% on the Medicare fee schedule? Like, what is that? The information that I was able to ascertain to date appears to suggest it's 20% over the Medicare fee schedule, but I do not know that in writing. So once we take that away, I mean, ultimately right now we're just looking at solutions, not really even price tags as much. The rates that are set for retirees this year are set, so I do not anticipate that it could change any rates for us in 2023, but it doesn't mean that then the plan experience is going to have a larger rate in following years, including as possibly next year. What I will also remind council members is this move cut the insurance rate, the price that the pensioner pays and the price that Metro pays in half. So while, I think everybody deserves the right to be paid fairly, I mean, the cost of providing medical care is not cheap. I think it's worth saying that, even 20% when you're not facing a 100% increase that you were last year is something that ultimately the plan may bear, whether it's in a single year or in subsequent years, if that makes sense.
So if working it out means either Metro pays that 20% extra that they're wanting, right? Is that what I'm understanding?
Well, Humana, potentially, but there's
But then
a
they'll
whole
pass it down.
collection of solutions, yes.
Yeah, but then if it's out of network, that means, and to correct me, but out of network, that I pay that extra,
So
right?
what's really interesting about this? So, Medicare Advantage plans governed by federal rules, right? So, the way it would work today, the answer is no. That members in a Medicare Advantage plan cannot be balanced bill if they go to a Medicare provider, and Vanderbilt is a Medicare provider. So all the people that don't have Medicare Advantage, right? Anybody who's post-65, you almost have to have Medicare A and B, right? I mean, there are not a lot of options for retiree health care that you can afford outside of that privately. So Vanderbilt is a Medicare provider, which means that anybody who doesn't have, a Medicare Advantage plan takes their A and B, maybe just their A and B, maybe it's also a Part D or a supplement, and then go get services at Vandy, and because they receive federal funds, they are a Medicare provider. So as a Medicare provider, they cannot balance bill the member. Now, what I want to avoid is they don't agree to bill Humana, and then you've got a pensioner at point of service who is faced with having to pay that out of pocket and then get a reimbursement. Because this is a population on a fixed
Right.
income.
Right.
Or maybe is choosing between food and medications. That is the last thing, which is the reason why I'm like, work it out. That is, remaining network providers is advantageous to everybody, and is the way that I can ensure that the most streamlined process happens for our members, right? Out of network, if they bill Humana and they agree to do that, somewhat, but I could see periods of time where that might mess up, and then we really have to get our hands dirty and help the member out. But we have a benefit services staff that helps our members do that. But anything that's less confusing to members, when insurance is already confusing to begin with, that's always my vote. But they cannot be balanced bill, and my understanding is that is under the Medicare rules.
And I think to answer your question, Councilwoman, I think most plans don't have in-network and out-of-network is the same benefit. For this plan, when we designed it, we did that specifically for our members, so they wouldn't have to pay more. So if Vanderbilt would bill on the out-of-network, you, as a pensioner, would never see any difference. We would be picking it up off the back end, but Vanderbilt won't agree to do that. So.
That's totally true, because also with insurance, usually with a Medicare Advantage, you either go in the network, or if you go out, you don't have coverage, or it's a different schedule of benefits, just like the benefits we have on our active side, right? If you go in network, you might get the 80-20 split on the Blue Cross plan, but if you go out of network, it's 60-40, right? It's the same level of benefit to the member, designed that way by Metro for in and out of network for our members. That's the way we designed this Metro Medicare Advantage plan. So there's a couple of different things at play that are kind of coming in that would.
But Metro takes the hit from, okay.
And I will just say for the Metro retirees, which is like the number one focus group, but for all of your constituents that have those individual Medicare Advantage plans with Humana or WellCare, they don't have even the remote option of the out-of-network. They all have to stay in-network. So we have to have Humana and Vandy work it out for those. I mean, Mike can get something more, hopefully, but that is for your group of your taxpayers, that won't be the case if they have an individual policy with a Humana Medicare Advantage plan.
Did they demand this 20% increase across the board, like to Blue Cross, to all the, and so some of them said okay and some of them said no? Or did they just pick and choose the providers that, or not the providers, but the service providers, like the insurance companies, to make that demand to?
So we don't know, we probably will never know. What I can tell you is that I have heard from reliable source within Vandy that they did go to most insurance carriers requesting something higher. And that it sounds like what we're aware of, at least, so Vanderbilt, I've heard that from a trusted source at Vanderbilt, although that's not necessarily substantiated. I knew about the Cigna one. That was substantiated because we have a very strong relationship with Humana, who's the administrator of the account-based plan. They also have the Cigna Medicare Advantage plan for retired teachers. So I was able to validate that. But the collection of strategies that they were able to party with, we don't know who all they negotiated with and what demands or collection of negotiations were met that satisfied Vanderbilt not taking the step to put them out of network. And I don't know that we ever will. I would love to be a fly on the wall. And I've encouraged, both parties. I think it's a collection of strategies. I mean, I think it could be cleaner if you just say 20%, but it's not probably viable. But what collection of strategies could Vanderbilt agree to that would allow them to keep providing the same quality of care and cover their bottom line cost?
Well, it's a shame that the people that are being hurt by this are the people that are on fixed incomes. It's hard to find a doctor that will take the geriatric, whatever that definition is. I don't know what the age starts, but those, not a lot of providers are taking new patients, and so it really puts them in a bind to either have to come extremely out of pocket or have no medical care at all based on they want 20% more. Like, it really makes me mad that that's what we're dealing with here, and we've got people that are dependent on. There's anyway. Okay, stop.
Quick question, and you don't have to elaborate, but of course the first priority is to hopefully they come to an agreement and we don't have to make changes, so people don't have to change their doctors, pensioners, particularly. However, if for whatever reason they don't come to an agreement, is there a contingency plan? Are there options for Metro to partner with another hospital? And is that being thought of? You don't have to go into specifics, but
I will tell you that every plausible strategy is being considered.
Okay.
We are trying to think through how it could work, what would work, what we can legally do, what we couldn't legally do. Would that make sense for our members? So everything's on the table for us to consider as a contingency plan. A lot of the solutions are complicated and they're not easy to set up. So I want you to know, like, this is certainly a high priority, but I'm like, okay, what's a stopgap? Because stopgaps are not always pretty. Is there one? Here's the one thing that at least I feel better about. If we were not in a healthcare hub where we didn't have a lot of great access to care, this would, I'm not happy about this. I think you hit the nail on the head. This is the part that of all the populations we're gonna hurt. This is particularly awful. I'm grateful that we have access to other care, and then what those partnerships could look like to make sure that we could, facilitate as quickly as possible a transition of care. I feel like, again, I don't want to lose hope that we work this out, because it's broader than just Metro, even though ultimately that's what we have to be concerned about. I'm hoping that for a greater community that they reach something, but yes, it's all on the table. We're trying to play out every scenario that is even possible just to see, could this work, and trying to figure it all out. But the good part is, we've got a lot of access, a lot of great hospital corporations. If you're going to Vandy, then you can get to a St. Thomas or an Ascension. Now we just got to help very easily with high touch, help those members get there if they need to, as a worst case scenario.
thank you. Thanks for being here and for your work on making the best outcome possible.
The answer's always money at the end of the day, but what is the impetus of this? Because this is going to put Vanderbilt in such a bad light. Like, what's the impetus? What do they do? Are they bluffing? Are they asking everybody? What's your gut feeling? What's the reason they're doing this?
So, I don't know, but I would say, you guys, record inflation is, I don't think anything's immune from it, right? So, and we've got, healthcare providers, nurses, and doctors that got taxed pretty hard. And you want to talk about already having a shortage of those things. Now you've made the shortage probably even harder post-pandemic. I guess to Mike's earlier point, like, it's hard. I want everybody to work this out, but it's hard to point fingers at this point because we don't have all the facts. We haven't heard a response from Vandy, but to ignore the fact that healthcare systems have been taxed super hard and that record inflation is happening, and we've made hard to recruit and hard to source positions like nurses even harder to do post-pandemic. I mean, I'm sure the cost of doing business has gone up significantly like everybody else's.
It's a business. I mean, religion's a business, but I just don't know why they would prioritize something that is this. I just can't imagine the headlines that they're not going to weather those very well. Like, there's got to be something else.
And that's why I think I keep pushing this collection of strategies, whatever it is. Like, maybe cleaner to do something else, but.
Anyway, thank you.
Gary, did you want to have?
If you don't mind, Mr. Chairman.
Sure.
And I'll try not to keep y'all very long. But first of all, Mike, thank you, and thank the mayor's office, and thank the HR and the Employee Benefit Board. But the firefighters union and three of the other employee reps, when this came before the Employee Benefit Board, were opposed to it for a different reason, though. And the very reason that they were opposed to it, they were afraid that Humana becoming the sole provider before they had options would wind up holding us hostage. But just the opposite has happened. Nobody ever dreamed that the medical facility would hold hostage. I think the damage is already done, especially since someone has already agreed to an agreement. So that kind of puts us in a box. If another entity has already agreed, and I think I heard you say that somebody has already made an agreement with them.
Verbally, that's what we've heard.
So if there's a, that's pretty much going to make us follow suit. So my question to you would be kind of follow up what the council lady was saying. And what is the 20%? We keep saying 20%. What is that dollar amount? What is that cost?
We won't know what that translates into premiums until the next rates are set, and that is the way that the federal guidelines work.
And when will
Because
that
this
be?
is fully insured. I mean, probably early summer.
Yeah, well, late April's when they finally, CMS issues the call, and so,
But by the time it goes to the board, it's
Yeah.
usually
Yeah, it's summer.
May, June.
yeah.
Okay, and then outside of working the deal out, which I hope very little hope that you will, to be honest with you, and real disappointed in Vanderbilt for what I think is blackmail, I'll use that word. But you need to step back and look at other options as well, in case this does not pan out to what we all hope it will. And I'm sure y'all are working on that. And sometime in the near future, I would hope you would share your plan with this committee chair and the committee members.
And I think everything's on the table. I'm not lying about it. I mean, you cannot lose sight of the big picture, how this all plays out. It is complicated, and so everything's on the table. Until we have more information or we see how this is playing out or not, it's hard to know that there is one particular strategy we should get behind, right? But I will tell you, the sole priority is our Metro pensioners. That's it.
And I have no doubt. I have no doubt.
I said it, I mean, I pretty much led this effort personally from the beginning. If we pick a different strategy, I'm not precious about that. But I unequivocally said to the board today, and everybody knows it on the board, I only have one agenda, and it is our Metro pensioners. Our Metro employees and pensioners are my only agenda, and that is it.
You mentioned, Mayor, Mr. You mentioned that we may wind up just shutting Vandy off and going to other providers. And I'll give you a personal story here. I know an individual, I'm not gonna call her name, but she had heart issues when she was a child. She still sees her child cardiologist, and she's a grown woman. Well, she's old enough to be retired and under Medicare, so. And she's got that same doctor at Vanderbilt she's had since she was a little child. It's gonna be hard for her to lose that physician and go to another physician outside of Vanderbilt. But Vanderbilt doesn't seem to care, and it's out of y'all's hands, I get that. So, this is personal to a lot of people is what I'm getting at, and it's very detrimental. I'm not affected at all. It doesn't bother me one way or the other because I don't have a Vanderbilt provider. Don't want one now, but excuse, thank you, Mr. Chairman.
Sure. Thank you very much for the comprehensive update. There is a late filed resolution that has been filed encouraging both parties to find that amicable, mutually agreeable resolution that we hope for. So please keep us posted. Yeah. All right. We are adjourned. Thank you.